Welcome back to HeInfo. Today, we're diving into a powerful medication you might have heard of, Indomethacin, also known by its brand name Indocin. If you're dealing with arthritis, gout, or shoulder pain, this could be part of your treatment plan. But here's the key. Knowing how to use Indomethacin correctly is critical for your safety and health. Let's get into it. What is Indomethacin? Indomethacin, Indocin, is a prescription nonsteroidal anti-inflammatory drug, or NSAID. It works by blocking enzymes, COX-1 and COX-2, that produce prostaglandins, the chemicals that cause pain, swelling, and inflammation in your body. It's FDA approved to treat several moderate to severe inflammatory conditions, including rheumatoid arthritis, ankylosing spondylitis, osteoarthritis, gouty arthritis, except in extended-release forms, and shoulder pain from bursitis or tendinitis. This medication is not studied for children under 15, so it's typically used in adolescents and adults. Forms and how to take it. Indomethacin comes in three main forms: immediate-release capsules, extended-release capsules, oral suspension liquid. Let's talk about how to use Indomethacin correctly, depending on which form you're prescribed. 1. Immediate-release capsules. Take them exactly as directed, usually 2 to 3 times a day with food or milk. Why with food? Because it reduces nausea and stomach upset, which are among the most common side effects. 2. Extended-release capsules. Here's where precision matters. Do not crush, cut, chew, or open these capsules. Doing so can damage the medication's time-release mechanism, leading to more side effects or reduced effectiveness. 3. Oral suspension. Always use a medication measuring cup, syringe, or dosing spoon, not a kitchen spoon. This ensures you're taking the correct dose, especially because this liquid can be potent and dosing errors are common with inaccurate measurements. Common side effects. Let's talk real side effects. Clinical data show headache in about 12% of users, nausea, stomach upset, and dizziness in up to 9% each. These are typically manageable, but there's more you need to know. How to use Indomethacin correctly. Dosing guide. Let's walk through the usual adult doses based on different conditions. These dosages come from FDA guidelines and clinical best practices. Acute gout. Dose: 50 mg orally or rectally, 3 times a day. Duration: until the gout attack resolves, usually 3 to 5 days. Important: extended-release capsules are not recommended for gout attacks. Patients often feel relief in just 2 to 4 hours, with swelling decreasing within a few days. Bursitis or tendinitis, shoulder pain. Immediate release: 75 to 150 mg daily in 3 to 4 divided doses. Rectal suppository: 50 mg up to 3 times a day. Extended release: 75 mg once or twice daily. Duration: typically 7 to 14 days. Always use the lowest effective dose for the shortest time needed to control inflammation. Mild to moderate pain. Dose: 20 mg 3 times daily or 40 mg 2 to 3 times daily. Used for short-term pain management where NSAIDs are appropriate. Rheumatoid arthritis. Immediate release: start at 25 mg 2 to 3 times daily. Maximum single dose: 100 mg. Maximum daily dose: 200 mg. Extended release: 75 mg once or twice a day. Suppositories: 50 to 200 mg per day in divided doses. During acute flares, your provider may increase the dose by 25 to 50 mg as needed. Ankylosing spondylitis. Same dosing as rheumatoid arthritis. Patients with night pain or morning stiffness may benefit from taking up to 100 mg at bedtime. Osteoarthritis. Start with 25 mg 2 to 3 times daily. Adjust weekly based on response. Extended release and suppository options are also available. Max dose still capped at 200 mg per day. Critical safety tips. Take with food or milk to avoid stomach upset. Never crush or chew extended-release capsules. They're specially formulated to release slowly. Always measure liquid doses with a proper tool, not kitchen spoons. Avoid combining with other NSAIDs like ibuprofen or aspirin unless advised. Watch for bleeding signs, dark stools, stomach pain, or vomiting blood, and report these to your doctor immediately. Pediatric dosage. Patent ductus arteriosus. Neonates 500. 1750 g. Less than 48 hours age. 0.2, 0.1, 0.1 milligrams per kilogram 4. 2 to 7 days age. 0.2 milligrams per kilogram 4x3. Greater than 7 days age. 0.2, 0.25, 0.25 milligrams per kilogram 4. Doses given every 12 to 24 hours. Monitor renal function between doses. Max 2 courses. Then consider surgery. Rheumatoid arthritis, 2 to 14 years. Initial, 1 to 2 mg/kg/day in divided doses. Max, 3 mg per kilogram per day or 150 to 200 mg/day. Up to 4 mg per kilogram per day with limited data. Use limited to oral capsules. Over 14 years, same as adults. Applies to RAOA, ankylosing spondylitis, bursitis, tendinitis. See adult dosing for specifics. Important comments. Use lowest effective dose for shortest possible time. Adjust doses based on individual response and treatment goals. Monitor renal function during IV therapy in neonates. Understanding how to use indomethacin correctly can make all the difference between safe relief and dangerous side effects. Always follow your doctor's advice. Take it exactly as prescribed, and listen to your body. If you found this helpful, give it a thumbs up and subscribe to HeInfo for more medically reviewed content.